We're going to start off this week's programme once again with our CIT Marbella Guest of the Week. CIT Marbella is a business networking association and a very renowned one in Marbella. Very good contacts. They even get to send a member of their association every week to Marbella Now. And this week we're welcoming the lovely Dr. Anna Bernad, and she is the family doctor of the International Hospital HM Santa Elena, which is actually in Torremolinos. So we're really looking forward to learning more about hospitals that could be interesting as an alternative. Dr. Anna, welcome to the programme.
Welcome. Thank you so much for having me here today. And yes, we're going to talk a little bit about the possibilities that this hospital has for, especially for foreign patients.
Well, it really is interesting because, especially here in our little nucleus of Marbella, the services are good, but they are limited. There is a lot of foreign people here.
Yes.
And we want to be understood in our own language. And I think knowing that there are other places that perhaps we can go to could be very interesting. Particularly, yes. I mean, having met yourself and a few more of the staff in the last few minutes, you all seem ever so normal and nice, not the pretentious.
Yes.
I think we have, particularly those foreigners who've lived here a long time, I think we associate the Spanish system with a little bit of reverence. And so you seem all very approachable.
Might be. I mean, not really approachable, you know, especially, you know, we have like two types of foreigners here. So, as you mentioned, people that have been living here since long time, many years. And then we have those that come here for lovely holidays that they've been planning since many months. And unfortunately, as it's life and things like that happen, they arrive here finally, they bought their tickets, they planned the beautiful trip, and something like disease or emergency situation happens. So this is the situation, like when, especially, you know, the feeling comfortable and being able to explain yourself in your own language matters.
You must have a big hospital, because I was looking briefly at some of the figures of the amount of international patients,
yes.
for example, that you saw last year. It's amazing to think there are that many foreigners, that percentage were sick and had to go to.
Yes,
in that area. It was quite astounding, really.
Yes, like having to account that I think that I checked numbers, and in 2023 we had like 14 million tourists that passed through Costa del Sol. So this number tells a lot, of course. And among those people, there are people that are in need of seeking a medical help. So I think that, especially, you know, illness itself is very stressful, producing anxiety. There's a fear that we don't know where to go. We don't know if we're going to be understood in emergency or in a consultation. So I think that the most important thing is to create a support for the patient to be attended from the very beginning till the very end. And I think that this hospital has a team that works together and can help it out so that the patient feels safe and only can focus on, well, it's already enough to have illness. The holidays that have been interrupted by this health situation. So I think that it's already too much for him or for her. So we can, let's say, do everything around that can help survive this critical situation.
Survive's a good word. That's a good word, if we can survive. Tell us a little bit. You say it's a group. Can you tell us a little bit about the hospital in Torremolinos and
yes.
the group that it belongs to, so we get an idea
so
of what we're trusting in?
International department for international patients. It's called like that. And the base is in the hospital, International Hospital HM Santa Elena. So the team that my friend will tell a little bit more about that has many members that work from the very beginning for the patient. So all the administration, that I think is one of the things that scares us most when we are in a foreign country. One thing is that we don't know if we're going to be understood. So the possibility that the help is provided in many different languages. Of course, English probably is one of the most, but there are many different languages that we can fluently help with, and patient is attended in his own language as far as it's only possible, of course, and the administration is done by the team from the very beginning.
And there's a lot of paperwork in Spain.
A lot of paperwork.
So that helps. That's a big help.
That takes away that part of the stress.
And what kind of things do you cover? So what if we, I mean, emergencies,
Yes,
what type of specialities or can we go there for?
Practically everything. So for
it's like
example, there's emergency
general
situation.
hospital.
Yes, there's an emergency situation that happens at the airport, for example. If the patient, of course, knows where to call, then the team here that is responsible for receiving that call, starting the things with the insurance, of course, because that's very important. We don't know sometimes where to call. We don't know how to deal with the insurance thing. And exactly where to go, because the emergency situation as well, sometimes we need help and guidance. So when the patient is in emergency and later on the patient needs to have a checkup and see a specialist, we can organize that too. So we
within the hospital?
Within the hospital. So we have a very wide range of specialists, from cardiologists to oncologists, depending what the patient needs. There are a variety of people.
Obstetricians and paediatricians
as well? Gynecologist, trauma, everything.
A real hospital?
A real hospital.
It's a real hospital?
It's a real hospital.
It's a real hospital.
With all the range of specialists and as well all the tests and additional things that we have to do with the patients when the diagnosing process is started.
Do you have outpatients as well?
Yes. So, from the emergent situation, when this is solved, of course, and we have access to all the necessary, let's say, tests. So when there is a need to be seen by special, concrete specialists, this is organized as well, so a patient doesn't have to wait a long time. That is what sometimes scares us a lot, that we need to go on a waiting list. Now there's a holiday. So sometimes the whole process can be dealt during the short holiday, and maybe even it's short enough to let the patient, the tourist, to keep enjoying the holidays.
Are most of the patients, the international patients at the hospital, from tourism? I mean, Marbella has a very large resident international community. Is Torremolinos the same?
I think that the numbers, my friend, I think, will explain a little bit more the numbers, but I think
putting a lot of responsibility on old Daphne there, going to fill in the blanks.
Yes,
hope she's checking her notes.
No, I think that we have both groups, but tourists, of course, it's a large group. And I think that, this is something that it's very useful for them, because especially if you live here, we have residents as well, of course, that can and use our help. But especially in the situation when you're here for holidays, for a few weeks, a few days, and something like this very serious happens, or not even, but you need a medical help. So the importance is that we, let's say, can take over this unnecessary stress, deal with administration, lead the patient where he needs to go, and all the bureaucratic thing, just leave it away.
Where are you located in Torremolinos?
We are located in the area of Los Alamos, so it's that at the very beginning of the entrance of Torremolinos.
Can you park there?
You can park there.
Okay, but if not, it's just to know.
I'm not good at parking.
Okay,
and
if not, we can just to let people know whereabouts they would park, because I think a lot of times
and it's very close.
That's a panic for people.
One thing is that it's very close to the airport. It's not far away from Malaga, so you can use your car, or you can get by any kind of, let's say, the transport. It's the Uber. Everything is close by. There is a train station that is probably maybe not even 5 minutes walking.
Perfect.
So I think the where it's located is brilliant. So it's easy access.
That's very important.
It's very important.
Where are you from yourself?
I'm from Poland.
Very cool. And now the family doctor.
And I'm a family doctor in St. Elena since around 1 year already. So, good thing is that, and most of my friends as well, we can attend in English, but of course if there are Polish patients as well, and Spanish. So they are very much welcome.
That's wonderful. It's nice to know, because I've never heard of this place. I know we stay in our own little bubbles here, but particularly when it comes to health, knowing that there are alternative places just down the road could be very interesting.
Could be very interesting. And I think that apart from, all the stress that is it comes with the fact that when we get ill, administration and all the bureaucracy that might be really difficult, to be attended in your own language or even the language it makes all the difference.
Well, Dr. Anna, absolutely delighted to make your acquaintance.
Thank you so much.
And maybe one day we'll show up there at the hospital to give everyone a behind-the-scenes view. Thank you so much. And now let's bring on Daphne, one of the nurses and the team. Thank you. I'm delighted to welcome on the set a young lady whose name is Daphne. And I had no idea that I was going to know this guest but I have met her before, albeit only online via Zoom, because during lockdown, Ali Mihan put me in contact with Daphne, as through the programme we were keeping people connected through doing the programme from my home via Zoom, and Seroptimist was one of the associations that I needed to speak to. So Daphne, so nice to meet you in person. What a lovely surprise.
Yes, because I was just looking at my WhatsApp and I thought, when was it? But it was actually in the middle of April 2020, so when we were all
at home, and I remember
we
were locked down like on the Monday. I recorded my programme normally on Tuesday. Between Ali and a few other people, I was connected to Zoom, and then we met. Before we start talking about your role with the International Hospital HM Santa Elena, I got that right.
Yeah, fantastic. It's a whole mouthful.
Just a moment, just let's have a quick comment about Seroptimist, because it's an amazing association.
Yes, it's a worldwide women's association. We have only a small group, 25 women working here from Mijas actually, and we have various different projects we're working on. We're still helping the food bank. We are working also on a project helping business women who have lost their businesses during the Dana. So we went on a visit to Valencia in mid-January. Dreadful what has happened there. It's so amazing how people have lost everything. And it's good that we as professional women can help other women. So we have done a fundraiser just yesterday, a jazz concert with Janet Powell. Maybe you have heard about her. And we were preparing a leadership academy for women, which will take place in Mijas in November this year.
Wow, congratulations and thank you. Yeah. And apart from all that, you're also a nurse at the International Hospital HM Santa Elena in Torremolinos.
Yeah, fantastic.
Tell us more. It's funny because it's a lot of words. It's not difficult, but there are lots of different words, and it's nice to find out about new hospitals. How did you get involved with Santa Elena?
I've known Santa Elena actually always. Where the HM was added, but the hospital has been existing since the 70s. But it's really nice because you see also that at the hospital now, it's also part of the group. You get a different vibe. I think also they're very well connected with also the hospitals in Malaga. We also work together with Ochoa here and in Marbella. So I think the connection is also of benefit to the patients, because they sometimes come and they say, oh, I've got pain in my belly, and you never know what comes out. And you need good specialists. You need the possibility to make tests right away to find out, what is causing the problem. We have, of course, the surgeon 24/7, the urologist. We have all the specialists who are also on duty to assist the doctors at the emergency department and make sure that we reach a diagnosis as soon as possible. Yeah.
What are the most common reasons that people show up at the emergency ward? Because I imagine there must be some silly reasons as well that could be avoided. Perhaps you can give us a couple of tips.
Yes. Well, there can be a lot of different things. I think also that people fall down and break something is, of course, a very common problem. And then we have our orthopedic specialist standing there to prepare whatever is happening. The abdominal pain can be anything. Also people when they have a pain on the chest, especially sometimes younger people when they have been partying a bit too wild. They have a very fast heart rate and they think they're going to die, and often they're not. They're just the reaction of the body.
Good thing that at least they come and see you, though.
Exactly.
Which is important. I mean, don't just feel that like, oh my God, I'm going to get in trouble. Get yourself help.
Exactly, because that's what we're for. And I think it's better to just check and find out it's nothing than the other way around. That people, they think, well, it can wait. It's not. No, if you have problems, if you have a very fast heart rate, it's always good to check it out and to not postpone. Yes.
I imagine it's a private hospital that when people stay in, one of the big fears And one of the big concerns as you get, if you don't have family in Spain, is that the Spanish medical system relies very heavily on the family to feed you, look after you if there's no one around. In the HM Santa Elena, I imagine if you're catering to foreign people, you're aware that a lot of people don't have that help. Do you cover that? Because it can be quite worrying for people.
Yes, and I think also that worry, it exists, but we're not, you know, it's Spain. I think healthcare in Spain is, comparing it even from Holland, where I'm from, I'm thinking the fast diagnosis, they can learn something there as well. People are always, when somebody has a problem, they can call we have a special number they can call, we send an ambulance, they are going to be checked out in the emergency department. That all goes quite fast. Family in the hospital, we have quite big rooms because it's important for us that the people have an individual room, that they're not sharing with another patient and their whole family, because it's not just the patient. So the rooms are all individual rooms. There's a bed, sofa bed or hospital bed for the family member who wants to stay. We even provide some food for the family who stays. If there's nobody coming in, we have also our team of auxiliary nurses. They make their rounds, they help people, also prepare them, help them with the food. It's not an issue anymore. It's not an issue the way it was.
Because I know that one is a big concern, and I was recently just accompanying a friend in hospital, and it was a public Spanish hospital, which isn't the same thing, but it's nice to just address the issues that I know are of the most concern. Well, Daphne, very reassuring to know that you're also involved with the International Hospital, HM Santa Elena in Torremolinos, so we've got good touching base there.
And then when you are there in the morning, I always work from Monday to Friday, I would always come in and say, hello, how are you? My name is Daphne from the International team. I always make my round, I make the rounds with the doctors. Because we have, of course, patients who speak. We have a lot of Dutch-speaking patients also. They come from Marbella, they come from Torremolinos, they're everywhere. So most of my colleagues, they speak at least 3 or 4 languages. French,
fabulous.
German, Dutch, of course, English. So
very reassuring. And as I say, we get very congested here in medical services, so you've got another alternative. And Daphne and Dr. Anna and the team ready and willing to welcome you. Thank you so much, Daphne. Lovely to see you again.
Yeah, thank you for having us.
And this time in person.
Yes, that's so much better than only via the screen. Yes.
Thank you.
Yeah, thank you.